Hello, everyone. This is Julia from Active Balance Healing, and today I'm going to talk about craniosacral therapy and why this is a modality you must try this year. So, this is the cranium, okay? This is where the brain is housed. Now, the ventricles in the brain, they produce a liquid called cerebrospinal fluid. It's really thick, viscous fluid that is important to lubricate around the brain and make sure that your spinal cord is well nourished, the nerves, that it's lubricated, allowing the vertebrae to move around, and also hydrates the discs in between your vertebrae, making sure that you don't have decompression. Now, the cranial bones fit together like a jigsaw puzzle, okay? They perfectly fit together and they work as a system to go away from each other to allow for the influx of the cerebrospinal fluid. And then they come together to create the compression that sends the fluid all the way down your spinal cord, all the way down into your sacrum, which is around right here at the bottom, around your pelvis. And the sacrum actually goes back into extension, then into flexion, where it pushes the cerebrospinal fluid all the way back up the spinal cord into your brain. Now, there's an ebb and flow of between 8 to 12 repetitions back and forth in a healthy adult of this fluid, and this is called the craniosacral rhythm, the movement of the cerebrospinal fluid from your brain all the way down to your sacrum and back and forth. So there's two factors that can affect the health of this system. The first one would be blunt force trauma. So any motor vehicle accident, any head injury, whiplash, any high activity and high contact sports, rugby, hockey, anything, football, anything that actually has high contact with you getting injured. So any injuries to your head, to your neck, anything like that can definitely throw off this system. It can create enough pressure to rotate one or more of these cranial bones out of alignment, and that will jam the system. Now, the other factor that can affect the system is repetitive strain activities. So if somebody has a job where they're driving for prolonged periods of time, or anybody that has a desk job and they have to work on a computer for prolonged periods of time, they have their arms elevated at this level. And what it does is it actually repetitively, when I say repetitive strain, meaning when your arms are elevated, your muscles are getting tired because they're overworked. And if we don't do stretches properly and daily, what happens is these muscles actually shorten. When they shorten because they're overtired, they're not doing their job as part of muscle groups that do certain motions. When these muscles are shortening, what happens is they pull one or more of these different bones that they're connected to. So it could be right behind the ear, which will be the temporal bone. That's where the sternocleidomastoid connects right here. Or if we clench a lot, so people that have a lot of stress in their lives, well, nowadays, who doesn't, right? But some people, they do clench throughout the day because they're stressed, sometimes during sleep, grinding your teeth. All these different factors are going to create strain on these muscle attachments to the cranial bones, pulling them out of alignment. Now, what happens is if one or more of these bones are slightly out of alignment, remember how I said that they fit together like jigsaw puzzle pieces? They work as a system. So if one of them is slightly rotated, it jams the system. Now, the bones actually cannot open. Why is that so important? Is because the influx of this really thick viscous fluid, the cerebrospinal fluid, is still getting pumped right around the brain. But now the bones are not opening to allow for the influx of that fluid. So what happens is there's a lot of pressure that is being exerted on the brain from the outside in from this excess fluid that doesn't have enough space for it. So now your brain is basically getting squished from the outside in from this thick viscous fluid constantly. Now, if this is not resolved, your body is going into a state of alarm. It activates the system called sympathetic nervous system. It is your fight or flight. So whenever you see a lion standing in front of you and your body gets ready, your heart is pumping really fast, your pupils dilate, you're feeling edgy, you're feeling anxious, you're getting ready to fight for your life or to run away. So this is the system that gets activated. Over time, if the system does not get shut down or your body doesn't have a chance to rest, what happens is there's a lot of different chemicals that are being sent throughout the body. It affects your inflammatory response. There's inflammation throughout the body. It affects your immune system, lowers it quite a bit over time, of course. The cortisol level, which is the stress hormone, is elevated in your body and constantly putting a lot of strain on all your body and all your muscles. Now, that causes quite a bit of strain if you think about it, right? And what can we do about it? Now, your body actually tries to correct this problem. Now, it changes the osmotic pressure between the blood vessels and the brain, and it tries to get rid of excess fluid by dumping whatever fluid it can get from around the brain, not cerebrospinal fluid, but excess fluids around the brain. So the nearest and the biggest cavity is your nasal cavity right here, okay? And so this is where the symptoms come. Your body is trying to dump excess fluids. It goes down your nasal cavity. So now we get postnasal drip. If you're experiencing this, listen closely. Now, having a little bit of a running nose, constantly feeling like you have to swallow, but there's nothing really there, trying to clear your throat, but nothing's coming up. Feeling like your throat is irritable. Sometimes you may even feel like you have a cold or you have allergies year round, but that's not the case. Your cranial system is just out of balance. Now, anybody that experiences dizziness and vertigo, listen closely. When the next area that your body actually tries to get rid of this excess fluid is your ear canal. So right here, okay? So when the bones are not aligned, the temporal bone is not aligned along with the other ones, what happens is the brain, the body and the brain, they get rid of excess fluid. The area between the brain and your eardrum is actually the area that's responsible for your balance, okay? So proprioception, being able to walk in a straight line and not having to tip over, that is the balance center of your body between your brain and your eardrum. Now, when fluid gets dumped in there and the bone is not aligned, then it doesn't actually drain out of the body properly. So when there's fluid sitting in that area that is responsible for your balance, what happens is any little movement, any little shift of your head will actually cause the fluid to move around, slosh around in your ear canal. So what happens next is basically like putting you in a dinghy boat in the middle of the ocean and there's a huge storm. Everything starts spinning around, you feel dizzy, it affects, like that's when you get the diagnosis vertigo. Unless there's pathological reasons for the vertigo, if your doctors can't find out what is happening to you, then I have so many clients that can vouch that once we bring balance to the cranial system and we actually help drain the fluid out of the ear canal, and that honestly helps so much, and it got rid of their vertigo symptoms. I kid you not. Okay, so now what can be done about this? Your brain is basically under attack 24/7. Your body doesn't have a chance to relax, to take a breather. Your muscle tension is so high. Now, what can we do about this? Okay, what I do is I go along each and every single suture in a very specific sequence. We're extremely gentle. This is such a gentle therapy. There is no high velocity thrusts or cracks, none of that. This is the most gentle therapy out there. I work along every single suture between the bones in a specific sequence to make sure that I realign the bones. I release and break down any type of structural imbalances, any fibrous tissue, any restrictions that are there. I actually am able to, and I specialize in breaking them down. Now, once I'm able to stretch the connective tissue, which is called fascia, that overlays the entire cranium, all the muscles that are really tight around the entire head, when we release all of those factors, it allows for the bones to actually resume their opening and closing. And that is the basis of what I do. Now, there are two really cool things about craniosacral therapy. So in the back of our skull, in between the parietal and the occipital bone, the occipital is the brown, parietal is the green. So right here, where my fingers are, there's two pressure points called the still point therapy. Okay, so when these 2 points are being compressed, two awesome things happen. Number one is there's a signal that gets sent through your nervous system for every muscle fiber to go into a complete state of stasis. So if any area of the body that holds tension from the top of your head to the tips of your toes. Every muscle fiber goes to sleep instantaneously, like this. So this is the time when a lot of my clients, about 95% of my clients, do fall asleep on the table, because your body goes into such a state of relaxation that you're just, yeah, you want to fall asleep. Now, the next signal that comes through is for your sympathetic nervous system to get shut down completely, like a light switch. Bam, we close that off. Okay, so why is that so important? Because your body is constantly under stress and duress. The alarm system that it raises from the compression on your brain, the intracranial pressure that is higher around your brain and is causing problems, that system is constantly blaring. It's constantly releasing all these different chemicals. It's affecting all your organs, your stress hormones, all these things, cortisol levels, like everything is much, much higher and elevated. So what we're doing is we're shutting it down. Now, the yin yang system to that, so when we shut down the fight or flight sympathetic nervous system, what happens is the yin yang system, the parasympathetic nervous system that's responsible for your rest, digest, sleep, relax, heal, that system is usually active when we're asleep. So your stomach starts gurgling, your kidneys are starting to filter into your bladder and it fills up. You're feeling very relaxed. Again, this is part of the system that really helps you relax. It stops the go, go, go activity of the brain, and it really, really helps to physically, mentally, emotionally, and spiritually relax yourself and to work through whatever your body and your soul needs to work through. I hope you enjoyed today's video about craniosacral therapy, its system, the symptoms that come about, and what I can do to help you. If you'd like to book an appointment, please don't hesitate to contact me at activebalancehealing.com. So activebalancehealing.com. Or you can reach me by phone 416-689-8918. You can either text me or call me and leave a message, and I will get back to you as soon as possible. I am taking new clients and looking forward to seeing you.